Okay, they say no sound. Let's do this. So how far? Can you hear me now? Ladies and gentlemen, how are you? Happy Sunday. I know you can hear me now. The sound should be better now. And the sound should be better now. Yes, yes, yes. How are you? How are you? The sound should be better now. This one I can tell that the sound should be better. Yes, yes. So how you day? Happy Sunday. I was so busy, I can't dey rush to do a lot of things. Yes. So how are you? How you dey and where are you watching me from? Dr. Israel. Uh-uh. Dr. Israel is on TikTok. Okay, so let's bring up Dr. Israel on TikTok here. Uh let's see. Okay, we can hear you. Dr. Israel, how far now? Hello. Welcome. This program holds every Sunday by 8 p.m. to 9 p.m. Nigerian time. So, Dr. Israel, may I hand over the floor to you? Start to the talk. Uh-huh. Continue, please.
Okay, so today we dey talk about the immune system because we notice say many people really dey get so many things to talk about the immune system,
Yeah.
and many people still get a lot when they dey do because of the immune system. A lot of so many funny things when people dey do, all in the name of trying to improve their immune system, or in the name of trying to know whether their immune system dey increase or if their immune system dey low. So today we dey here to tell you what immune system is all about and things you need to do to take improve the immune system. So, but one thing you suppose know, as we dey always dey talk in this platform, what we dey do every Sunday, we not dey prescribe medication for people. So note that one first. We not dey prescribe medication for anybody. So any question wey go link to like say make we prescribe medication for you, we will likely not going to answer that question. So that if you come see say we don't answer your question, it may be say your question dey look like say na make we prescribe medication for you. So make we go to the business of the day. The business of the day is we wan talk about the immune system. So when we say the immune system, we dey talk about those soldiers wey dey our body wey dey help us dey fight against everything wey no suppose dey the body. Now the body get the normal things wey suppose dey, the normal amount of blood wey suppose dey, the cells wey suppose dey, everything wey suppose dey, and all of them dey their right position, dem dey their right place. So immune system help us dey guide all those things wey dey their right place, in the sense that when they see anything wey no suppose dey there wan come enter there, they go help fight those things comot, so that make those things no enter where dem no suppose dey. Yeah, that is, even when infection enter the body, the immune system go try to fight them away. When bacteria, every kind of things, rubbish, even some things wey we eat wey not suppose enter some part of the body, the immune system go help us fight these things away. Now this immune system, we get the one wey be say we dey call dem innate immune system, so dey follow us come, and we get one wey we dey call acquire, the one wey we collect. So those are the two type of immune system. Dr. Fred, are you with us?
Yeah, yeah, I dey hear you loud and clear.
Okay. So that are the different two type of immune system. Now, when we talk about immune system, I know they mention we get the immunoglobulins, and one good thing, one funny thing about it is that almost all of them are protein, and they are protein, immunoglobulins. So, and as I said, the non we're not going to talk about all those part of it. But the more function that to make sure say they help us fight infection, they help us fight diseases, they help us fight things we're not supposed to in the body. But in some cases, they may come overreact, they may come over exaggerate, not even they fight wetin suppose dey the body. That one na another thing wey we go look at maybe as we continue to dey talk, this things about the immune system. Now this immune system, the one wey we dey collect, wey just follow us come, most of them start from even when we born, when they born us. Now this immune system dey follow us dey come, and as they follow us come, they dey try to understand everything wey concern the body. So once any infection enter the body, the immune system go build memory cells. So those are cells wey be say dey help us dey remember say this infection don fit enter the body, so that when they enter the body again, the immune system go get up, go come fight this war wey we dey talk. And one type of the immune system wey we dey look at na the white blood cell. Now, the red blood cell na the normal cell, then the white blood cell, they are mainly the immune system, and now they contain mainly the soldiers wey they help us fight all these infections. Yeah, all these infections. So it just be like having the Nigeria, having the military setting. The military setting get Air Force, get Army, get Navy. Now, so the body still take get all these ones inside the white blood cell. The white blood cell are the full name. All of them come get their own different small one where they get wetin they do for the body. We also have I don't know if you can mention different immune system, but as I earlier said, these are some things where you really need to know about the immune system. Dr. Fred.
Yeah, thank you so much, Dr. Israel. Now, I want to be sure that if you dey watch me from Facebook, YouTube, and LinkedIn, you dey hear Dr. Israel. So let me know, everybody where they watch me right now. I want to be sure that you dey hear Dr. Israel for TikTok. We dey talk about the immune system. The title of the topic, immune secret unlocked. Little secret about the immune system wey people no know. Number one be say right from when you born your pikin, as mentioned, you dey get the immune system, and that one na from the mama breast, you understand, because when you born pikin, pikin no get, but when the mama dey breastfeed the pikin, small small pikin go dey collect from the mama, even from the mama blood, then later the pikin go dey develop im own, dey grow. But we realize that as we dey grow, e get many things wey we dey do to also help us support the immune system. One very popular one from small na wetin we dey call vaccination. You know, when you born pikin, dem go tell you say, give am this vaccine, give am this vaccine, because that pikin body e dey exposed. The soldiers for the body, the soldiers of the body, they no get power. So you are giving them those vaccines to help the body produce soldiers, make the pikin no get those problem. Okay, so they say that they hear you. Very good. So they will give vaccines, and then gradually, the pikin go dey grow. But commonly, one thing wey we realize is that a lot of people, their immune system dey suffer. Their immune system dey go down. And e no go good make we no even talk about those little little things wey dey make immune system go down before we come talk about little secret as well that can help your immune system. Are you with me? So there are some things that can actually take down your immune system, and when these things no dey or these things over plenty for your body, e fit cause you problem. Number one, very popular one on the list na stress. I believe say young men and young women dey watch us here. A lot of young men and young women dey work, dey hustle for their family. But sometimes you go hear, doctor, every time I dey feel like this, I dey feel sick, I dey feel sick. E might just be that those soldiers for your body, you don too work, you don carry them go down, they no get power to function again, they are weak. And when you are stressed, this stress dey increase hormone for your body. This hormone go come dey affect those your soldiers. Those your soldiers no go come get power. So if you dey watch us right now or you dey lis ten to us right now, wherever you dey, one very common thing wey dey destroy the immune system of our people na stress. Very important, stress. Another one again, before I go hand over to Dr. Israel, make we continue. Na some of the things wey we dey take into our system. You know, some people, as they dey smoke, they dey take unhealthy drinks. Make we leave am like that, unhealthy drinks. As you dey smoke, you dey take unhealthy drinks, those things e get some chemicals wey dey produce in your system. One of them oxidants, another one wetin we dey call reactive oxygen species. All these things, small small dey affect your immune system. Now one thing wey I no know whether Dr. Iche dey talk about am, your immune system too, e get some soldiers inside wey dey protect you from even cancer. You dey hear me so? So those ones, their job na dem go dey waka inside your body, go dey find whether e get any of your cell wey don dey misbehave, wey the head don dey malfunction. So those cells inside your immune soldiers, their job na to dey find all these cells wey be like dey fit form cancer. They go come carry am go down, fight am, comot am into the system, comot am. But in some cases, when you destroy your immune system or your immune system go down, the ability of your immune system to protect you from all these things, e don go down. Okay, so may I hand over to Dr. Israel again, make he throw more light on this, and then we'll continue. Dr. Israel, over to you.
Okay, so Dr. Fred don tell us two major things where they actually they cause reduction in our immune system. One of them say stress, the other one are waiting we they take in. Another one are a lack of exercise, waiting we not they do. Yeah. So most people will not they do exercise. It's still okay, yes, lack of exercise, sedentary lifestyle, they're all the same thing. So people when they live a sedentary lifestyle, they know they do exercise, if they want to play some morning till night and all that, it still they help to reduce the immune system. So those who refuse to take vaccine, because as we said, vaccine are one way where they help us build up our immune system. It's not like the immune system not there, but this vaccine go activate this immune system. So when we not take some certain vaccine, the body not go they don't go recognize those diseases, or those problem, or those problem when they come.
Dr. Israel, are you there? Okay,
Yes, I'm with you.
okay.
Those problem when they come. So another thing, I don't talk residential lifestyle. We don't talk about smoking. We don't talk about drinking. Then some medication when we they use. Those people when they take some mostly steroid. People they take steroids. It's also they reduce their immune system. So some other things that some diseases, there are some disease states where person will get for body. Those disease they fight the immune system. And one of those diseases now what do they call let's just talk all this way. One now, HIV. HIV dey fight the immune system. So as they fight the immune system, they make the immune system not the they make people not dey really dey get power in that aspect. So that is why you need to always dey build your immune system. Another disease na cancer that will also help to reduce the immune system. Another disease na okay,
Even
okay,
diabetes.
more leave am like that. Even diabetes, yes, diabetes, hypertension, all those chronic, a lot of chronic disease that they help, that they reduce the the immune system of the body, that they reduce the immune system of the body. So that is the reason why even when you get them, they put you on medication. It's also very good to look to do other things to build this your immune system up. Another one are some chemicals where we dey work, our workplace. There are some chemicals where we go expose ourselves to. So radiations wey we also expose ourselves to. These things go still fit reduce our immune system. Okay, I think I will leave it as that. Okay, stress still join lack of sleep. People wey no dey sleep well, when you not sleep well, it go still reduce the immune system. Okay, so I think all these ones wey we don mention, if we fit work on all these ones sef, I think we will be able to build our immune system up to a particular point. Dr. Fred already talk about wetin we dey do. Now we come talk about the food wey we eat. That one na drink wey we dey drink, smoke wey we dey smoke. This one now when I dey talk na the food wey we dey eat, the kind of food wey we dey eat. When we no dey eat balanced diet, dey eat a lot of junks. Yeah, those will also help. It will also reduce the immune system. Okay, Dr. Fred.
Yeah, thank you so much, Dr. Israel. Now, if you just dey come, wait, abeg, we are talking about immune system, immune secret, unlocked. So, if you ask us any question wey no dey related to the topic, we no go respond to you. We are sticking with the topic today. And then when we don finish, we will come take your question. So, make sure say your question dey related to the topic tonight. We don mention some of the things wey dey carry people immune system go down. And this is why anytime we talk about the immune system, we dey beg you, you can do some very simple things to help your immune system. And if you are sick, you get chronic disease, and your doctor tell you say do this and do this and do this, you no do am, your immune system can actually suffer. Do you understand? So now when the immune system come go down, what are those things you fit see for your body? Which symptoms the person fit get? Because remember, these soldiers, dey waka all round your body. Their job na to protect you, make you no fall sick, make you dey okay. So if they come go down, the soldiers are not working, your body no dey produce well or whatever thing tired, extremely tired for no reason. Now I beg you in the name of God, not be say because we mention tiredness, we mention cold, we mention frequent catarrh, flu, we mention recurrent infection, and you dey lis ten to us and you get some of these symptoms now, we are saying that your immune system is down. No, 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 no. It means that you go need to get a special session with your doctor, make dem find out wetin dey happen to you, because your problem might not just be immune system, your own fit be another thing entirely. But we notice that when some people immune system go down, number one, they go dey feel tired. Number two, dey fit dey get every time frequent catarrh, frequent sneezing, frequent cold. You can't just explain what is going on with you. In some other cases, you go dey hear say doctor, I dey always treat malaria, I dey treat malaria, I dey treat malaria, not knowing that the soldiers in your system, they have gone down. You dey lis ten to me, abi? Now, if you dey take care of your body, you know dey stress, you know dey smoke, you dey eat well and every other thing, maybe some of these things wey we mention and you fit relate, e might just be that e be like say my immune system is down, maybe I can change one or two things to help me. Dr. Israel, over to you.
Okay. So when we say your immune system, and Dr. Fred don talk, I think I would say those are mainly the real things wey you go notice. You notice say you dey fall sick almost every time. You dey tired. Any small thing you do, you don tire.
What happen? Dr. Israel, wetin happen? Dr. Israel, what happened to your network? Hey God, okay. So I'm trying to see if Dr. Israel, we no dey hear you again oh. Okay, so you go dey feel tired, sometimes you fit dey get joint pains, fit dey sneeze up and down, just dey sneeze, dey get cold, go just dey feel cold, dey feel cold. Sometimes you go talk say I dey treat malaria, treat malaria, treat malaria, treat malaria every time. E might just be that maybe your immune system don dey collect something in your body, dey chop down those immune cells. You dey follow me abi? And then in some cases, you fit even come dey lose weight small small, you fit dey lose weight. This might just be a sign that the immune system dey go down. For some other conditions, the person fit come notice say maybe the mouth the tongue don dey white up and down, you're having like your tongue is white. These are some signs that we might also see to know that you might be suffering from what? Immunosuppression. The immune system don go down. Now I beg you in the name of God, if you dey watch this video and you feel that maybe you have a low immune system, enter hospital. Enter hospital, go follow your doctor talk. If you come here come dey ask me what can I do, what can I do, enter hospital make dem check you. Are we okay? Now I want to be sure that Dr. Israel, let me see. Okay. Oya, I don send you invites. I've sent you an invite. Okay. So these are some of the signs that the immune system don go down. Wetin you fit do to help your immune system? What can you do? Number one, you're back. Okay. Dr. Israel, hello.
Yes.
Okay, hey, okay, you are back. You're back.
Can you hear me?
Yeah, they hear you.
Okay. So as I was sorry for that, my network went off. So as I was saying, so there will be one specific because the body gets they fit handle some kind of infection, some kind of viral infection or fungal infection. The body can handle that without stress. But if your immune system go down, you can't notice all those things will come they come out. All those things where the body was supposed to handle will come they come out from the body. So that one will also give you an idea, say, oh, my immune system don't go down. And it may be something that they cause your immune system to go down. So it's not to treat those symptoms, it's for you to look for what did they make my immune system go down. Now that thing that you need to treat. Because if you treat that thing, your immune system will go back to normal. That's something you need to know. Like for patients who get HIV now, some people feel not know say they get HIV until they come to see one viral infection, what would they call herpes zoster. So when they say herpes zoster, normally the body is able to the immune system can take care of herpes zoster. But because their immune system don't go down, you come to see and say they come out. And when you come to come out, some people, if you can't go they treat only the herpes zoster, you not go find waiting they cause the herpes zoster, then you never really treat yourself. So in that case, now that one will call it people come go do tests, come find out say the HIV, then call they treat the HIV, then treat the herpes zoster before the person will be fine. So that's the time say there are some diseases when immune system supposed to handle, but because of if they don't reduce, those diseases will come they come out. I would already talk about tiredness. Say some persons will come they tiredness. Sometimes the healing, person go sick, you know, go quick heal. you treat malaria finish, after the third day you treat am finish, you come dey tell yourself say I'm still feeling weak, I'm still tired. E fit your be na your e fit be say na your immune system na im go down, na im make all those things dey happen. Then sometimes we go dey see some swollen lymph nodes. The lymph node na part of the immune system. Those lymph nodes dey dey help us dey fight infection. Remember, I know say almost all of us don experience this thing. When we injure our leg, before you know, one side for near the waist don swell, or na that side go dey pain us well well. That one na lymph nodes na dey there. Dey help us dey make sure say all this infection don go pass that side. So when you start to dey have swollen lymph nodes, unexplained, you know say some things don happen. Sometimes growth delays, you know say some things your immune system also don reduce. So when you don dey notice all these things, sometimes you no even need to notice go reach far ones. Common, just a tiredness alone is something that should let you know. When we say tiredness, we are talking about unexplained tiredness. Not be tiredness when you don carry heavy load, don waka from there to one place, you come feel tired. That one na because you do all those activities. So this one na tiredness wey be say you cannot explain why you are tired. So you need to check, because your immune system fit be say na im low. Dr. Fred.
Yeah, thank you so much, Dr. Israel. Dr. T, Alpha, how you dey? We get Dr. Israel in the house. Who else dey here? Dr. Tim Tokpe is in the house. I saw Dr. Chukuma before in the house. We dey talk about the immune system. So if you ask us anything, can I bring you up? If you ask us anything not related to the topic, we no go respond to you at all. We are focusing on the immune system. Now we've talked about wetin the immune system dey do. Wetin be the things wey you fit do to bring down the immune system. We also talk about wetin be the sign say the immune system go down. We spoke about it. Now, may we give you some little tips to help your immune system. Very, very little tips. But remember, if you get any of those symptoms wey we mentioned earlier, abeg you enter hospital o. No sit down for here dey look for say make we treat your condition, because like we mentioned before, there are many things that can take the immune system down. Is that okay? So little tips, and then we will take your questions on Facebook, on YouTube, on LinkedIn, and then on TikTok. Okay, so Dr. T, Alpha, good evening. How you dey?
Good evening, Dr.
Yeah, welcome. Well done, sir. So, number one, starting from beginning, what are those things that can boost your immune system? I'll talk one. I know we have Dr. Israel in the house on TikTok. We have Dr. Temitokwe also on TikTok. I'll hand over to them, and then we'll continue like that. One very important thing, if you carry your immune system go down, so where you go need to correct, where you go need to avoid, na sleep. If you are sleep deprived, your immune system can be so messed up. So if you want a secret that can help your immune system, try to give your body time to rest, time to recuperate, so that make it get itself back. Because as you dey work, the German, dey hustle, your body no fit get time to repair itself. So e fit carry your immune system go down. So let me hand over to Dr. Israel, then Dr. T. Dr. Israel, over to you.
Abeg, Dr. T don come, me talk, me don tire.
Oh yeah.
Okay, so thank you. Well, sleep is one of the main things, and some of the things that we overlook. Another thing is viruses. Viruses are things that can bring down your immunity. Now, when I say virus, you may be thinking HIV, hepatitis. No, HPV, no. Even viruses like a common cold, it can bring your immunity and pave way for other problems. For instance, you don't notice that someone that has common cold, you are sneezing, suddenly your tonsils start swelling. The next thing you notice bacteria will set you have pus. So another thing is malnutrition. because your body has a way of maintaining your body's its defenses. When the food you are eating does not contain the right amount of nutrients to keep those functions, the immunity will drop. What the body will now do is now start breaking cells, breaking organs so that it can keep up. So malnutrition is a big problem. Another thing that can happen that can make immunity go down is things like pregnancy. Pregnancy is an immune inhibiting
Suppressor.
state.
Yeah.
That is why when you are pregnant, you say, okay, go to the hospital, take this, see your doctor, treat this. In fact, we noticed that many people that have had chicken pox when they were little and they had no problem, when they get pregnant, the chicken pox will come back because this pregnancy has suppressed your natural defenses. And now the problems that were not affecting before. Another thing is, let me see. Medications. Medications have one, including the cream. So you start with cream. The cream you use on your body. The bleaching cream, caro yellow, caro blue, caro green. They can lower the defense mechanism, which is the form of immunity of your skin. If you take certain tablets, also they can lower your immunity. And the problem with that is that you will not quickly notice. You just notice that I've been using this particular cream, suddenly I start having skin rash. Then I start having blisters. Suddenly I have a wound that doesn't heal on time. The same thing when you use certain tablets that make you high. I will not mention the name, you know the names. Some of those tablets depress the immune functions. Even some tablets are even given by doctors. They would have given you warning, but many of you will not stop after the number of days they gave you. You continue using it. And you use it to the point that you start prescribing to your neighbor. Doctor, give me this medication for so you can use it too. So it can lower your immunity. So I mentioned viruses, I mentioned cancer, I mentioned pregnancy. Cancer, okay. I've mentioned medications, I've mentioned malnutrition, and Dr. Fredostar mentioned sleep. Off the top of my head, these are the things I can think of that can lower your immunity.
Okay. Dr. Israel, can you hear me now?
Yeah.
Okay, so based off
Yes, I can hear
yeah,
you.
based off waiting Dr. T talk right now. So the little things that can help your immune system. Number one, you spoke about sleep. I talk about sleep. Number two, your nutrition, the kind things where you they chop, the kind things where you they drink. Then avoid medication, self medications. Get some medicines where you they take those medicines, feed take down your immune system. Dr. Israel, you want to add another one?
Exercise, regular exercise is very important. Regular exercise is very important. Then we will take steps to avoid infections. So because with steps like common hand washing, just wash your hand, is enough to avoid a lot of infections, and that will also help us to make sure our immune system they they with us, they right. So exercise coupled with all what we've been saying, exercise and that's what now only those ones I want your stock.
Okay.
Dr. T, welcome. Yeah, thank you, bro. So I think I forgot to mention three major things that we overlook. Number one, smoking can affect your immunity. Number two, alcohol. Number three, the Oga of them on the general version of all of them. Stress, physical stress. You hustle, you find money, you know, you rest. It diminishes your body to the ability of your body to replace worn out cells, ability to cope with past stress. So when you continue exposing yourself to that stress, you hear say, I broke down. Me, I know if I've done work back to back and I don't rest, I'll start sneezing. Sneezing when I know they sneeze normally. I'll start having the body pain. I'll start having itchy eyes. One eye go red, one eye go yellow. I'll come be like a traffic light. So stress, smoke, cigarette. Then for people that are overweight, if you add too much weight, it will affect your body's immunity. If you're obese, overweight. That is, you chop life. You're not watching your weight. Like Dr. Israel said, you're not exercising. You get down from AC office into AC car, into AC house, into the couch. no exercise for you because they chop you, go nothing do you. Door dash. This can increase your weight unhealthily and suppress your immune function and also the ability of your body to fight foreigners or infections. So that's it for me. Now my head is
Yeah, yeah, yes, nice one. And that part you mentioned about obesity. So if you dey obese, your body weight pass the normal, you also fit put your immune system at risk. Now, if you get question for us on top immune system, this is the time for you to ask now for immune system. But if you ask anything that is not related to the immune system, no vex, we no go answer you because today na the immune system we focus on. Then one other thing wey I think we need to also talk about in addition to all the things is that some people go need vaccination. Some people will need vaccines to protect them because e get some of the immune cells wey your body no fit generate unless you get vaccinated for that one. One popular one na hepatitis B vaccine, because when you take the vaccine, you dey tell your body say, in case this thing enter my system, I need you to fight am make e no give me problem. So one way to also protect yourself and build your immune system against hepatitis B na to get the vaccine for hepatitis B. Why? If you no get am and e enter your body and your immune system no dey okay, your immune system cannot clear it in the acute phase, because in the acute phase, within that 6 months, some people might be lucky, their immune system can clear it, even human papilloma virus. But if your immune system can't collect, you are stressed and other things, this infection fit pass the acute phase, come sit down inside your system, come cause you problem. Are we together? So e go good say as you dey hear us right now, um make you do wetin, do these tips wey we don mention. So hepatitis B vaccine, get yourself tested and get the vaccine. Number two, the human papilloma virus vaccine dey important. Which other vaccine again, in case I forget anyone? Let's see.
okay. So vaccines usually vary with age. There are a set of vaccines they will give for a child that is born. What they are basically trying, what vaccines do is they trigger your immune system to start and be ready against those infections. So the childhood vaccines, especially from birth, hepatitis B, HPV, BCG,
Polio,
tuberculosis,
polio vaccine.
measles, all those ones they will give you. Polio, they give you all those ones. When you now reach even tetanus, in some people that maybe before the age of 10, they would have given you some of them. When you reach age of maybe teenage, you are exposed to wounds, they will give you booster vaccine for tetanus. If you now grow older, you now start getting pregnant, the mother, they will tell you, okay, go for tetanus vaccine to cover you for life. If you are working in the, you become a doctor, you become an engineer, you're exposed to blood, they'll give you a hepatitis vaccine. If you go and you're working in maybe a lab where they deal with viruses, they will give you COVID vaccine, they will give you some vaccines. If you stay in a place where certain diseases come seasonal, they will talk about influenza virus vaccine. So these vaccines, we keep on modifying it. At some point when we were in secondary school, they gave us a meningitis vaccine. So they will keep on giving you these vaccines. It was primary school. They'll give you all these vaccines to prevent, depending on what is endemic, what is happening in the season that time. And when you are in your old age, you start talking about influenza virus. They will start talking about vaccines that will help you when your immunity is naturally dropping. So these vaccines may be dependent on the age, your work, your career choice, and also the location that you find yourself. In addition to everything we've mentioned before.
Okay. Yeah. So I have a question here quickly. It says, Dr. Israel says, can aging be part of a low immune system? Can aging? So we have a question on Facebook. Can aging be a part of low immune system?
Yeah, yeah. Aging is a natural, might say natural way when the immune system they go down. And in fact, in terms of aging, everything they go down.
Mm.
Every part of the body system is going down. So aging, yes, will reduce the immune system. So that's why as you grow old, as Dr. T was saying, as you grow old, there are some vaccine where you will need to take. All those ones will see they help you, because you don't dey old. Now, old person just be like small pikin in a way, because so many things don't happen, their body don't weak and all that, so their immune system can also be reduced as they grow old. It's a one natural way when immune system dey reduce.
Okay. Dr. T, you want to say anything on that quickly?
Yeah, so I didn't want to go too off topic when I hinted on old age. See, what do we call old age? Old age is some of your cells are not able to replicate, they're not able to reproduce themselves. Some of your cells are growing old to the point where they cannot create new ones. So your systems are breaking down. For instance, you notice that someone that is old will begin to pee on themselves again. It's not because they have forgotten how to go to the toilet. It's because the organ that controls urine is weakening. The same thing will happen in the blood. The same thing will happen in the immune system.
Yeah.
Some of these systems are not as sharp. And again, remember that majority of your immunity is maintained by what you eat. But because you are advancing in age, the way you absorb nutrients from food is not as effective as before. That's why you hear supplement, they will put 50 plus, they will put 60 plus, because the quantity has to match the age. So with that age now, you need to now supplement certain things, because even if you eat all your balanced diet, there's an amount of it you can absorb because of the aging cells in the body. And because of that, immunity also, you have to now step in again, just as you did when the person was a baby. You start supplementing some of these things and helping those immune systems to last longer, or transfer it to an external system that is you're not supplementing. They're not looking at a change in diet. They're not reducing the stress that papa or that mama are going through, so that they don't have wear and tear too frequently or too fast, because the cells are not properly replaced. Like, oh,
Yeah, thank you. Okay, if you just dey come, you're just watching us. This program is Ask the Doctors. It holds every Sunday by 8 p.m. to 9 p.m. And we've been on this program for more than 5 years right now. So every Sunday by 8 p.m. to 9 p.m. we are here. In case you're just coming, you're welcome. We're talking about the immune system. We spoke a lot about it. So if you have any questions for us concerning the immune system, then you can drop the questions here. We would respond to you. Once again, we're streaming live on Facebook, we are live on YouTube, we are live on LinkedIn, and also live on TikTok. So you can go to YouTube and watch the video again. Now, we have a question here. It says, can supplement help build the immune system? The answer is yes. Very, very true. Yes, supplements can build the immune system. But there is a catch here with supplements. I see people engage in supplements. By the way, in case you don't know, I have a partnership with one supplement company. But some people believe that supplements will solve their problem. Dr. T mentioned age 40, 50, 60. But we have mentioned things before. If you are not sleeping, you are not eating well, you are smoking, you are taking alcohol, supplement will not fix that one. So don't think that supplements is the answer. I want to build my immune system. Which supplements will I take? If you don't fix those basic, you will drink the whole supplement in this world, it will not work. But if you have done all those ones, then the other nutrients, the other things that your body needs, you can gain them from supplement. Is that okay? Okay. Dr. Israel, want to add anything to this?
No, no, no.
Okay. Dr. T, any comment on this?
Aside everything that was mentioned, your phone, your internet is not just for TikTok. It's not just for content. You should also be able to go online and find out. If you cannot go to your doctor at that point, go online and find out, okay, In my community, what is happening when it comes to health? Is there a pandemic? Is there a disease that is common? What are the things that we can do to keep healthy?
Hmm.
Is there something be on par with health news? Because it's better for us, the doctors, if you are well informed and you are taking the measures to do what you're supposed to do on your own. The doctor will only come to give guidance. It reduces load on us also. So it is your duty to watch your health, to take care of your immunity. Immunity is especially because once immunity breaks down, we start talking about opportunities infections. For instance, when HIV brings someone down, something like skin rash, that before you just take oil or grease and remove it, will now become so big, it now become so troublesome. Because your natural immunity has been broken down so that the little guys will now start taking advantage of you. Cough that you just drink warm water and lick honey will not go anymore. Because your immunity has been broken down to the point that common viruses, like common cold, are now bringing you down. You start having itchy eyes, your body start getting weak. So take your time, look for health information that is authentic. Take this information to your doctor to verify it and act accordingly. It will help you stay away from the need for medications and drugs and hospital admissions.
Yeah. Thank you. Okay, now before we continue, let me do my own personal advert. My own personal advert. My own personal advert. A lot of you following me, a lot of you are destroying your page every day. I beg you, don't post people's content on your platform. You know, no they hear what? No they hear. And then when you develop copyright strike, you can't dey cry. So if you know that you are a content creator, you want to start, you don't know how to start, go and get my course. This one is not a beg, it's not, I'm not sweet mouthing you. You can decide to get or go to YouTube and learn. I'm tired of begging you every day. Be careful. Know how to post. Avoid this and that. But some of you, out of content monetization, you want to make money on the internet. You don't understand that it takes time and there's a process. You destroy your page. So if you know that you don't want to destroy your page, you want to get guidance, you want to get information that will help you, go and get my course. The link is on the page. Look for the link. It's cheap. Whether you are in Nigeria, in Ghana, in France, anywhere you are in the world, it will help you to give you the basic information you need. Get it oh, get am oh. May you no come dey beg me tomorrow. Please now, can I call you? Help me. No, no, no. I beg you. Go and get the course today so that you will not suffer. Let's continue with the topic today. Now we have a question concerning vaccine. Now, Dr. T mentioned people should get information, but if you notice, of recent, there has been a lot of people talking about not taking vaccine, not taking vaccine. And that's why we beg you also that ensure you have a doctor that you can speak with to confirm whatever you listen to. Because if you refuse taking these vaccines, like we mentioned in the beginning, if you get exposed to some of these diseases, like polio, imagine you refuse to vaccinate your child and your child gets in contact with the polio virus. Your child suffers from paralysis, or you refuse to take the tuberculosis vaccine and your child gets in contact, or you refuse to take the hepatitis B vaccine, you put yourself at risk. This is why I want to go further and say, please don't just jump on any information. Make sure that you can vet the information with your doctor. So let's talk about vaccine. How many times can someone take the hepatitis B vaccine? Hey, Dr. Snow. Dr. Snow is in the house. How many times? So it's majorly 3 doses. Dr. Snow is in the house. It's majorly 3 doses. The first one, then after 1 month, then after 6 months. And then in some cases, they might give you a booster dose. Some will tell you after 10 or 20 years. Sometimes they might tell you you might not even need it. Do you understand? But majorly 3 doses. Um, okay. Do we have any questions on TikTok? Let me see. Let me see.
Not related to the topic.
Okay, no, 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 no. Dr. Israel, want to make any comments on the vaccinations?
Yeah, on the vaccination, I want to beg even the healthcare workers. the healthcare workers in terms of hepatitis B vaccine. In fact, it is very important and it's very, I don't know how to put it, that every healthcare worker, everybody working in the hospital, working in any place that concern health, that concern blood, should take hepatitis B vaccine. It is very important because sometimes when it don't happen, they look for prophylaxis, they look for PEP. Hepatitis B really does not really, in quotes, does not really have PEP, any prophylaxis that you will not take after you have exposed yourself like that. So the vaccine is just the major thing that you will take that will really help. And yes, recently the new teaching is that after your third dose, you are covered for life. Yes, previously it is after 10 years you take the booster dose. Yeah, it's after 10 years you take the booster dose. So I just want to use this medium to say every healthcare worker, whether you're anywhere you work, in fact, even those that have hospitals and all that, you should make sure that your workers, whether not cleaner, they are all vaccinated. Because it is very important. It is very important. And I don't know why people they fear vaccine. I don't know why people they fear vaccine, but vaccine is very, very important. When malaria vaccine came out, they even pay me say malaria vaccine now is just for children. Say adult not fit take it. I was praying that adult can take it, so I will go and take it. So that's to tell you how important vaccine is. For me, I don't joke with vaccine. Once I hear vaccine, they go call taker. So please, let's get that, because as you take this vaccine, it helps to build your immune system. It helps to keep you away from a lot of diseases that normally or naturally you feel just get. But with vaccination, you save yourself from all this stress and you don't go waste too much money as well.
Dr. T.
Well, I don't have anything to add. It's a matter of uno no. If you have not gotten someone that has polio in your family, you don't know the importance of polio vaccine. And the sad thing is that there's no reversal. Once you get it, there's no reversal. There's no amount of prosthetic that will change. The same, excuse me, the same thing with hepatitis. So why not get the vaccination? You're talking about cleaner. Even the cleaner is the one that needs the vaccination more because she's the one that will clean the blood. She's the one that will gather the blood products. So why not get the vaccine and just save yourself the stress? The hospital visits, problems.
Yeah. Dr. Snow Weezy is in the house. Dr. Snow, good evening. How are you day? So we have another of our organs in the house on TikTok. Now, we spoke about the immune system, the things that can take down your immune system, the signs of a low immune system. We spoke about the tips, little things you can do to help your immune system. Before all this, we spoke about the jobs, the functions of your immune system, what they do. Dr. Israel also told us about how the immune system even starts from birth. When you give birth to your pikin, even as you born pikin, the pikin don collect from the mama because im body never produce im own. E go collect from mama, collect from breast milk, and then gradually. And then we also told you that if you think that you have a problem, maybe you think your immune system is down, speak with your doctor so that make dem find out wetin dey make your immune system go down. Maybe na one medical sickness wey dey inside your system wey you no know. So that when you find out that sickness and you treat that sickness, your immune system can come back. Because some people, what they do is, I'm having headache, you take paracetamol. I'm having catarrh, you look for this to take, not knowing that something else is going down in your system that you are not aware of. And then we spoke about vaccination. So if you have not vaccinated yourself, it's important you do so to avoid stories that touch. Not be say tomorrow you come dey disturb us, doctor abeg o, e don happen. What we do here is prevention. Prevention is better than what? Is better than cure. Okay. So let's try the round. Can difficulty in breathing make immune system weak? Okay, so let's respond quickly and then we round up. Dr. Israel.
Yeah, yeah. So
Okay,
Dr. Israel, go, go, go.
Dr. T, continue.
He dey drink water now.
as first talking, that's why I said so. So
Dr.
now
T, continue.
difficulty in breathing is a very vague question. It's a very vague symptom. Difficulty in breathing as a result of what? Normally, there's no relationship between difficulty in breathing and immunity. They are not related normally. But if your difficulty in breathing, for instance, is a result of asthma, and you're now taking some asthma medications that help to reduce sensitivity to triggers that will also cause immunity to drop, it may be as a result of that. But naturally, no. If you have had a kidney transplant or you're about to go through kidney transplant and you take a medication that suppresses immunity, or you're about to go for maybe you're having maybe a lung cancer and they tell you to take certain immunosuppressive drugs or anti-cancer drugs that can suppress the immunity, may also be as a result of that. But on a normal way, low difficulty in breathing and immunity, they're like this. They're not related. I wanted to ask, have you talked about signs that or symptoms that make people suspect, that can make some people suspect that they have low immunity?
Yeah. We spoke about it. Yes. Yes, we did. So we are out of time. The program is 8 p.m. to 9 p.m. We try to keep the time on the program. So if you are just coming, I'm sorry, you might want to watch the video again. Yeah, we spoke about the immune system, the science. So let me just allow Dr. T just give you, even though we spoke about it or he wants to add, give us a brief recap of the whole discussions, and then we can call it a day on the program. Dr. Tim, over to you.
Yeah, okay, so I joined late, but what we're talking about is how to keep your immunity, how to prevent your immunity from going down, and things you can expose yourself to. So, number one, your immune system is your soldiers of your body. They help prevent you from falling ill, they help you preserve your body functions, they help you defend against common infections, bacteria, fungi, or viral, even parasites in some cases. How do you know that your immunity is? Just notice that you're feeling tired for no reason. You notice that this infection keeps on coming, keeps on repeating itself. You notice that you're just getting this bruise easily and you're trying to, it's not healing on time. You notice that you're just, you're having problems with digestion. You're noticing that normal everyday activity makes you weak. Things that normally before didn't stress you. These are some of the things. Now, what are the things that you have done that could have contributed to this? Number one, are you overweight? Are you underweight? Because a lot of people don't talk about being underweight. People that don't eat enough, people that are malnourished. Are you stressed in any way? Are you not getting enough sleep? Are you chronic drinker of alcohol or chronic smoker of tobacco? Or are you using any other medication? Because alcohol also falls under medication. Do you expose yourself to triggers? For instance, you're in a place where blood is being shared or blood products are being used, and you're exposing yourself to sources of infection. You expose yourself to sexual intercourse indiscriminately without protection. Have you skipped vaccination? They said, okay, there's Ebola, or there's, let me use something that's more common, there's influenza, seasonal virus, and they are shouting that you can't take it, and you say, no, 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 you don't take it. Have you taken the vaccines appropriate for your age, for your location, for this season? What else? We now talk about how do you recuperate? How do you get yourself fortified? You need enough sleep, you need enough rest, exercise, drink a lot of water, eat the right amount of food. Don't overuse certain medications. Avoid stress. Get vaccination schedules and follow it. Use your medications just exact as you were given. If you notice anything that is different, energy levels, one is not healing, any allergy, go and see your doctor. Do not, for the women, your private parts, the vagina has its own immune system. Do not overwash that place, or else you expose yourself to other organisms. And from time to time, learn about the right information for your health, and always cross-check with your doctor. I
Thank
hope I
you.
summarized enough.
Yeah, thank you so much. This one is even more than summary. This one is another class. So for those that came late, I believe you gain one or two. Thank you so much, Dr. T. Thank you, Dr. Israel, for joining. And you that watched on Facebook, YouTube, LinkedIn, thank you so much for watching. You can go back on YouTube and get the whole information again in case you came late. Remember, this program is every Sunday by 8 p.m. to 9 p.m. We've been here for more than 5 years and we stick to the time. I'm sorry we cannot go much more than this time right now. Remember, if you have not gotten my course on content creation, go and get it. Oh, look at my face. Go and get it. Oh, this one, they tell you small, small. Oh, don't allow anybody deceive you. I want to make money on the internet, and then you destroy your page. You start getting depressed because some people are getting depressed because of social media. You need somebody to talk to you. So go and get my course. The link is on my platform. This one, now my own adverts. Thank you for watching. We'll see you next week. Like I always say, good life now waiting. Good life na sense. Take care and have a wonderful night. Bye bye. Au revoir.